Hemostasis, or blood clotting, is the physiological response to blood vessel injury and bleeding. This process involves coordinated interactions between endothelial cells, platelets, and circulating clotting proteins. Following vascular injury, activated platelets form a temporary plug to seal the wound. Meanwhile, a series of reactions occur, known as the coagulation cascade. Thrombin 2A, previously activated during the initiation phase, activates factor VIII and releases it from von Willebrand factor during the amplification phase of this cascade. Activated factor VIII interacts with factor IXA, previously activated during the initiation phase. This activates factor X. Activated factor X, along with its cofactor, factor Va, then converts more prothrombin into thrombin, which converts fibrogen into fibrin, and a clot is formed. Hemophilia A is an X-linked congenital bleeding disorder caused by a deficiency of coagulation factor VIII, accounting for approximately 75% of the total hemophilia population. Bleeding severity in hemophilia A is generally correlated with factor VIII activity levels. Severe and moderate forms of hemophilia manifest with increased frequency of spontaneous bleeding episodes, often into joints and muscles. Indications and usage. Esperact, antihemophilic factor recombinant glycopegylated XC, is indicated for use in adults and children with hemophilia A for on-demand treatment and control of bleeding episodes, perioperative management of bleeding, and routine prophylaxis to reduce the frequency of bleeding episodes. Esperact is not indicated for the treatment of von Willebrand disease. Important safety information. Contraindications. Do not use in patients who have known hypersensitivity to Esperact or its components, including hamster proteins. Please see additional important safety information at the end of this video. Please click the link provided for prescribing information. The primary aim of care is to prevent and treat bleeding by replacing the missing clotting factor. Esperact is an extended half-life recombinant factor VIII molecule that replaces the missing coagulation factor VIII needed for effective hemostasis in congenital hemophilia A patients. The half-life of Esperact is extended by conjugating a 40 kilodalton polyethylene glycol molecule to an O-linked glycan in the truncated B domain of recombinant factor VIII. Phase 1 clinical trials demonstrated a half-life of 19 hours, which is 1.6-fold prolonged compared to patients' previous factor VIII products. Like endogenous factor VIII, Esperact is able to bind von Willebrand factor. Non-clinical studies have revealed that PEG is eliminated from plasma and tissues via the kidneys and through feces. Upon activation of Esperact, the B domain is cleaved, generating activated factor VIII, factor VIIIa, with the same primary structure and specific activity as endogenous factor VIIIa. Factor VIIIa is then able to complex with factor IXA during the amplification phase, in turn activating factor X, leading to the activation of the prothrombinase complex, in turn activating prothrombin to thrombin. Esperact is an extended half-life glycopegylated recombinant factor VIII molecule, indicated for use in adults and children with hemophilia A for on-demand treatment and control of bleeding episodes, routine prophylaxis to reduce the frequency of bleeding episodes, and perioperative management of bleeding. In a Phase 3 study, single-dose PK trials were performed in 42 adults receiving Esperact 50 IU per kilogram, demonstrating a half-life of 22 hours. Important safety information continued. Warnings and precautions. Hypersensitivity reactions, including anaphylaxis, may occur. Should hypersensitivity reactions occur, discontinue Esperact and administer appropriate treatment. Development of neutralizing antibodies, inhibitors, has occurred. Perform an assay that measures factor VIII inhibitor concentration if bleeding is not controlled with the recommended dose of Esperact, or if the expected plasma factor VIII activity levels are not attained. Adverse reactions. The most frequently reported adverse reactions in clinical trials, greater than or equal to 1%, were rash, redness, itching, pruritus, and injection site reactions. Please click the link provided for prescribing information.